If you're taking it for hair loss, which I experienced at a very young age, so I know what that feels like, and it can have a real impact on a young individual's life, there's a lot of really effective therapies that you can do. I mean, hair transplant works very well. It's very precise. So I think there's alternatives. I think understanding what that spectrum of alternatives is really important.
So describe what post-finasteride syndrome is.
It's a variety of symptoms that men will complain of after taking either, the BPH dosing or the kind of hair loss dosing of these medications. Decreased sex drive, impotence, anejaculation,
Inability to ejaculate.
Those are obvious and apparent things for any young man trying to do it, but there's a lot of other associated findings with it, like depression, just general change in your affects. So those are harder in my mind to attribute to medication, but patients do complain about it. But when you have a patient who's young, healthy, has a great interest in sex, et cetera, and they take this medication for hair loss and they can't get an erection, they have no interest in sex, they can't have any orgasm, those are real, and those are directly, in my opinion, definitely related to the drug.
And what do you think is the approximate frequency of this post-finasteride syndrome?
Yeah, that's probably where there's more debate, right? I think, and some people would say 5%, some people would say 15%. I mean, it depends on where you look, but I think about it like 1 in 10 guys will have appreciable issues with it. And it's not just the young men, it's in older men too. It's just that they're maybe on average less interested in sex or less sexually active.
It's less apparent in an older guy.
But I definitely see it. So it's why I never really use it in my practice. I mean, it's just such a limited drug, in part because the efficacy is limited, in my opinion, in terms of managing lower urinary tract symptoms. And then the side effects from it, this post-finasteride syndrome, are real. The duration of these symptoms can be highly variable. So some people will stop the medication and they'll have resolution within a couple weeks once the drug washes out. But there are people that I know who have it, permanently.
Yeah, there are case reports, and that's the really scary stuff, which is the case report of the guy who goes to see the hair doctor. They put him on finasteride. He experiences all of these symptoms. They're horrible, and they're very noticeable because he's 25 or 30. He stops taking the drug, and it never comes back.
Yeah. So those are rare, like you say, but they're real, and they are associated with the drug, and there's no doubt in my mind.
Let's assume that the frequency of this is 1 in 10, and we want to avoid it at all costs because we never know if it's reversible. Is there any sense of what predicts susceptibility to this?
It's a good question. It's a post hoc diagnosis. I haven't seen a great paper that really took 100 or 500 men and really tried to evaluate what it was that would predict it. So I'm not aware of any high quality study that can help predict that association.
Would you be comfortable recommending to a patient who's considering using a 5-alpha reductase inhibitor for hair loss that they might be better off looking at other medical and non-medical therapies for hair loss?
Yeah, I mean, I don't recommend it for use in any man. If it's one
BPH or otherwise.
Yeah. Why? If you're taking it for hair loss, which I experienced at a very young age, so I know what that feels like, and it can have a real impact on a young individual's life. There's a lot of really effective therapies that you can do. I mean, hair transplant works very well. It's very precise, and I know people who've done it, and they're very satisfied with it. So I think there's alternatives. I think understanding what that spectrum of alternatives is really important, because when young guys go to these kind of pop-up shop clinics, they're not given the full kind of
they don't have a consent with this.
Yes, and they don't understand what the long-term effects are, because in addition to the post-finasteride syndrome, as a prostate cancer biologist and individual who treats people with prostate cancer, the other big thing has to do with what its effect is on your PSA value. It halves your PSA value if you take the medication for 1 to 2 or 2 to 3 years, and after 5 years of being on the medication, it reduces your PSA number by about 2.5x. So
that does not come back?
If you stop the medication, your PSA will rise. But the biggest issue is not whether or not it suppresses your PSA or not. It's lack of awareness that it does amongst the patients and the providers. Because if you're going to some men's health clinic for your finasteride or your finasteride for your hair loss, you may not mention it to your internist. And usually when you start that for hair loss, you maintain it for life.
Yep.
And so classic case, I see it probably every other week, of a guy whose PSA is rising on finasteride. If your PSA begins to rise on finasteride, we'll talk about PSA in general in a sec.
Yep.
If your PSA rises on finasteride, you have a problem. That is a warning sign that there is a cancer, and likely an aggressive cancer growing in your prostate.
Wow.
And guys aren't aware of it. And there'll be guys whose PSA...
And not just guys, it might be that physicians aren't aware
That's right.
of this.
So if you're a man, you take finasteride starting at age 25, your PSA is 0.5. It may begin to rise, and it goes between, let's say now you're 50, so 20 years later, it goes between 0.5 to 1 to 2 to 4. That's 4 years where your PSA is doubling, which tells you got a really bad problem before it's even anywhere near being on the radar of the patient or their internist. So in my opinion, it's just, you got to be very, very careful with these medications, particularly taking them that long.
And this says nothing about the other issue, which is not having DHT probably isn't a good thing if you're in the business of taking advantage of your androgen receptors, right? You're taking away the most potent androgen in the body, and androgens do really good things.
Absolutely. I mean, the impact on a man, I mean, the extreme examples are those individuals with no testosterone. We induce that in individuals with advanced prostate cancer, and there are rare cases for men who are born with no testosterone at all. But in general, yes. I mean, for a healthy man, it's absolutely imperative, in my opinion, that you maintain a, eugonadal state. And that's debatable what that means, but I think, in my opinion, you can titrate to a functional eugonadal state in almost all men if their testosterone levels are low. But having testosterone around is just critical for
everything from metabolic health to structural health.
Everything, really, for everything.
And probably mood and a whole bunch of other things.
All that, exactly.